Acute mesenteric ischemia basically means acute ischemia to the small bowel. Mesenteric ischemia, the term basically means ischemia to the small intestine. That means lack of blood supply, cut off of blood supply, or reduced blood supply, or interrupted blood supply to small intestine. That is the meaning of the term mesenteric ischemia. And if this sudden reduction of the inflow of the blood to small intestine is occurring suddenly, acutely, abruptly, we use the term acute mesenteric ischemia. So acute mesenteric ischemia is equal to sudden, abrupt, acute hypoperfusion or reduced inflow of the blood to small intestine. This is the first thing you understand. So our next question logically would arise that who supplies mostly the small intestine? The major supplier of blood to the small intestine is SMA, superior mesenteric artery. And if you know what are the fundamental features of superior mesenteric artery, what is the uniqueness of superior mesenteric artery, then the answer would be easily understandable that what actually leads to sudden reduction of blood supply through blocking the blood flow in the superior mesenteric artery. Superior mesenteric artery has two uniqueness. One, that it has a larger diameter, and second thing, that it has a acute takeoff angle, they say. And these two features are ideal for emboli formation. So what happens usually that from the dislodged thrombi, which is typically coming from the left ventricle, left side of the heart, could be due to atrial fibrillation, could be due to bacterial endocarditis, could be due to valvular heart disease. They usually come and they have a larger diameter also, this superior mesenteric artery. These things favor emboli to come through superior mesenteric artery, and that's why inferior mesenteric artery is smaller diameter. The emboli usually don't come through this. Then what happens, this emboli comes through the superior mesenteric artery, and after their origin, after going through a while, at the origin point of the middle colic artery, there is a constriction there, there is a narrowing there, and that emboli usually get lodged there, impacted there. They cannot move further, and this is the typical onset of acute mesenteric ischemia. So an emboli which is originating in the left side of the heart, typically in the backdrop of atrial fibrillation or valvular heart disease or infective endocarditis or post-myocardial infarction, this emboli is coming and getting into the superior mesenteric artery. And superior mesenteric artery, when there is a narrowing there, they can easily get into the superior mesenteric artery because there's a larger blood vessel, and there is a concept called takeoff angle is there that makes it easily accessible there to enter into the superior mesenteric artery. But what happens after that there is a constriction or narrowing there after its origin, after going through origin. So that anatomical narrowing area, the emboli which was coming, they cannot move further, they get lodged there, and that causes occlusion, complete occlusion of the blood supply to the small intestine, resulting in acute mesenteric ischemia. Now what is happening, acute mesenteric ischemia, what happens that your complete wall, the wall of the small intestine, the blood supply is getting cut off, but there is no peritoneal irritation is occurring. So pain is occurring, patient can feel severe pain, but the pain cannot be, when we do physical examination, as there is no peritoneal irritation, the pain which is described by the patient looks quite disproportionate. That is the classic feature of this disorder. So this is about the acute mesenteric infection. Acute mesenteric infection typically is caused due to an emboli which is coming from left side of the heart and lodging into superior mesenteric artery, because superior mesenteric artery is unique to have this emboli there, and there is a sudden narrowing in the superior mesenteric artery, as an anatomical narrowing where they get lodged and causes sudden, and this is happening acutely, suddenly, and that causes acute mesenteric ischemia. Having said that, acute mesenteric ischemia can also occur due to acute mesenteric thrombosis in less common cases. It can also occur due to non-occlusive pathologies, like let's say you have a shock and there's a generalized reduction in the blood flow, or there is some drugs like diuretics can cause generalized reduction of blood flow to the intestine, small intestine. So this causes what is happening, there is a generalized reduction of the blood flow that can also cause, these are called non-occlusive causes, or sometimes could be due to mesenteric vein thrombosis also. So outflow is blocked. But the major cause is definitely the embolism which is originating from the left side of the heart. And why it gets stuck in the superior mesenteric artery, because I mentioned that the superior mesenteric artery has some anatomical uniqueness which makes it very much susceptible for emboli. Another form of mesenteric ischemia is also there. This was acute I described. This is called chronic. Now, chronic mesenteric ischemia is a little bit different. It usually occurs due to atherosclerosis of this mesenteric vessels. Atherosclerosis is the key cause. And chronic mesenteric ischemia typically has a different presentation. They usually present with postprandial pain. They can have patient of weight loss, and patient is averse to food, because whenever he eats food, what happens after that, he suddenly feels pain after 30 minutes or 1 hour. Because that time after 30 minutes or 1 hour after the food intake, there is a time for digestion and more blood supply is needed. But there is atherosclerotic narrowing of the blood vessel, and that causes postprandial pain. And it can be thought like a variant of chronic stable angina, which you see in the cardiovascular system. It's a variant of that in the GIT. So that's why it's also called intestinal angina. So the point is this: acute mesenteric ischemia basically means it's a ischemia, reduced blood flow to small intestine. We have used a complex term, but actually it means reduced blood flow to the small intestine. And acute mesenteric ischemia can occur due to many causes, but the number one cause is the emboli, due to the uniqueness of SMA, which makes it susceptible for the emboli lodging. And chronic mesenteric ischemia usually occurs due to atherosclerosis, and it usually also known as intestinal angina. So these are certain key features that you can keep in mind about the term mesenteric ischemia. Thank you so much.